Foremost, I'll start from the very basic, that is about the NEET SS, how the exam is. I know that most of you would be knowing about the exam in general, but I'll be sharing and giving you a brief idea about how the exam pattern is from now. So first of all, it is section oriented, section based basically. So it will be basically the 150 questions will be subdivided into three sections of 50, 50, 50 questions each, and with each having 50 minutes for the section. And the important point why I'm telling you is so that from now, when you start preparing and when you start solving the MCQs, you have to practice with that section based pattern so that your mind and you are trained such way that you have to solve the questions in a time limit and then move on to the next section. Because if you solve this 50 questions, that is section A, and you move on to section B, this will get locked. You won't be able to revise that. That is a difference between the old pattern and the new pattern. That once you have solved and submitted, or it gets submitted or saved, basically you cannot go back to the previous section. So whatever you want to solve, revise, go through again, you have to do in that section time of 50 minutes for one section. And then you move on to the section B, subsequently to the section C. So here, what feedback I received from the 2024 candidates is that usually sometimes what happens is that when either of section A is tough for you or the section B is tough for you, you cannot judge that the next section is tough, easy, or lengthy, or you will be able to complete in time. So make a habit, and that is why the Surgical Scholars TND in our app will be having section based from day one right now, so that you have to practice in a time based manner so that your speed is there even if the question is lengthy or short. So that is the first and very important thing which you all need to keep in mind, that whenever you're solving an MCQ, we have a habit of solving in the practice mode, wherein you read the question, select the option, you get the correct and the wrong answer, and you get the explanation. That is not how you need to practice the MCQs. You need to practice the MCQs in the exam oriented fashion in the test mode, that is in our app. So practice mode is for people who are in the wards or in the clinics or on the way when you want to just go through. That is when you should do. But otherwise, MCQ practice should be in test mode and in a time based manner. I'll talk in detail about that. Now, if we come to the brief timeline, so I have discussed in the group as well that according to the PG exams, usually it can be in December, or if the worst case scenario, it can get delayed. So that is something which we have to keep in mind. But your target should be that the exam is in December. It can be there in that month, or it can be delayed. Nobody can predict how the national board and the exam they conduct, the authorities they conduct. So your mindset should be that you have to give exam in December, and accordingly make your timetable and schedule from now and read accordingly. Now, why I told this range, because you all must be having the query about, so you all may be having the query about how or how many months you have, how to make a schedule, because the dates are not fixed. So that is why you keep yourselves a month that I have to give exam in December and I have to make a schedule accordingly. In case exam gets delayed, you all will be in that positive mindset that you got extra time. But if you prepare in such a way that let the dates come, then I'll think about the final schedule, you'll not be able to complete and even have the confidence which you will have if you keep a fixed timeline from now, prepare accordingly, and in case the exam gets pushed, you will have more time to revise. So that is about the NEET SS, how it is conducted, about the timeline. This is obviously a tentative timeline. Obviously, nobody can be sure at this stage. Now, how to start your preparation? Now, this is very important because many students, they are randomly starting with reading theory. They take up some MCQ bank and they start solving randomly. That is not how it works. Because what I've observed in the interviews with the achievers of our students in the last year, I've observed that there is an equal balance between the students who are sitting and preparing since 1 to 2 years, basically, who could not crack in the first attempt, and many are fresh MS pass out who are able to crack. So what I felt is that the NEET SS pattern is such a way that if you give dedicated 4 to 6 months preparation now, you can definitely crack this exam. That is for sure. First thing. Next important thing about starting your preparation is your way of preparation. Now, why I specify this about the way of preparation is, if you guys have any doubt in between, just mention in the chat box. Yeah. So, I was talking about the mindset and the way of preparation. Now, why it is important is that because you may start, let's say I tell you that you have to start with Bailey, then move on to Sabiston, then you move on to Schwartz if you have time, or you combine with both of them if you're using a app content wherein the all three are integrated. So before you start even reading about Bailey, Sabist, and Schwartz, we have a habit. What habit we have is that when we read from the textbook, we tend to read like how we used to read in 11th, 12th. We read the book. Now, if you want to do a smart reading for NEET SS, I'll come to the point about the materials, how and what you have to use. But whenever you start preparation for NEET SS, the mindset what you have to keep is that whatever you're reading right now, if you are making notes by your own, if you're using Sushruta LGS notes, or you are using any other material, you should be mentally making a point in your brain when you read, when you mark, when you write, when you add your point, your go-to material should be you should be preparing your go-to material for revision from day one. So what I mean by this is that if you're reading or you're going to stick to the textbooks for revision, for first reading, second reading, revision, you should mark and add points to your textbook in such a way that when you come for revision, everything should be clear enough. Because go and watch the achievers videos of last 2 years. One common thing you will observe in all of their preparation, and which I advise, is that every single achiever had go-to material. That, for example, let's say if somebody had Swartz content from our app which they didn't study, they just prepared from Bailey's Avison because of their MS, and they wanted to cover the Schwartz. They just made a note of the points which we covered in our MCQs and made a note of that, and they kept it as a last minute revision material. And also, for example, you have to prepare your go-to material in such a way that one is that your theory revision is done. So you can either use our notes or make your own notes, and that note you have to make in such a way that at the end moment you should be able to have a pictographic memory of that, so that the most important thing which is going to help you solve the confusing questions is your revision. So your theory revision material. Second thing is the mistakes, what you are making in your MCQs, in your TN test, which you are taking right now, the test and discussions. If you're making any mistakes in that, any mistakes in the MCQ bank, any question you felt that it is tough and you were unable to solve or you were unable to understand, you needed help in that, make a mistake journal and write it and keep it handy topic wise, so that when you're revising you go through them so that points are covered multiple times. And for the students who are maybe fresh pass outs or fresh MS candidates who may have time to only read Bailey Sapiston and they're using our content, go and make note of the Schwartz difficult questions or the tough questions or the topics which you felt that you have not read. Make a journal for that. So this is basic thing which you need to prepare from now. This is how you need to start your preparation. Because why I'm emphasizing on this technical things, because in NEET SS there is no such thing like important topics. Okay, there is no such thing. Everything is important and question can be framed from anywhere. So Don't keep a fixed mindset that you have to cover this more, this less. No, doesn't work that way in NEET SS. And my mindset of guiding or mentoring students is that all of you should think that you have to get AIR1. And if you want to achieve AIR1, you have to keep the mindset of a achiever and prepare from day one. And this is how you start. So next, I covered about what to read and what to skip. There is no important topics, or if I tell you skipping, you can skip gynec, you can skip ENT, you can skip opthel, you can skip ortho. If some classifications are important, we will be covering in our content. But other than that, these things, I have not observed any question in last 4 or 5 years in NEET SS from this topic. So this can be skipped. Now, next about the effective study strategy. Now, I will cover for three prong approach. That is, one is for the students who are just studying. I'll be covering for those who are doing their MS residency and those who have passed out, who are SRs, who are working and studying. Now, I have only one tip for all three of this group, whichever you belong to, that even if you are able to give 10 to 12 hours, or if you're able to give 2 to 4 hours, or even if you're able to give 4 to 6 hours, the important aspect what you so even if you are just sitting and studying for 10 to 12 hours in a day, even if you are a MS resident and you are able to give 2 to 4 hours, or if you're working professional, you're doing your SRship or you're joined as a consultant somewhere, you're doing your duties and you have 4 to 6 hours, remember that in the achievers list, there were students from all three of the categories. So it doesn't matter that you are able to give less time or more time. The important thing is the quality of the time what you're able to give. So what is important is that me myself, before I cracked NEET SS, I worked and did my fellowship from Gangaram Hospital in surgical gastro liver transplant, wherein it was residency, wherein I used to get after my duty maybe 4 to 6 hours in 2 to 3 days per week. Other days I used to get few hours of 2 to 3 hours. So what I remember from my mentor, I pass on to all my students in the last few years that whenever you decide that you want to prepare for NEET SS, no matter you're getting 2 to 4 hours, or you're getting 4 to 6 hours, or you're getting 10 to 12 hours, your priority should be to go for the quality of study. Be it MCQ solving, be it theory reading, make sure that you give your 200%, and there should be satisfaction at the end of your study session that, okay, I've read 4 hours, I've read this topic, and your quality should be in such a way that when you solve the MCQ of that topic after 7 days, you should get minimum 70 to 80% correct. That is how good your reading should be. So that is a mindset with which you need to prepare. Because remember that, as I told, that in NEET SS, it is not like MS that I'll tell you that, okay, read this topic, give this much time to this topic, and it works. It does not work like that. So next, if I come to the most important thing, that is about the three textbooks, that is Bailey, Saviston, and Schwartz. Now, I lay more emphasis that if you can cover all three of them. Why? Because in last year and even before that, the ratio of question was nearly almost same in last year, maybe less in 2023 NEET SS, but overall, there has been equal distribution from all three books. So you have to cover Bailey completely, Saviston completely, especially the specialty parts, because we have a habit in our MS that we read Bailey, we read GIT from Saviston and endocrine from Schwartz. That is a general, the consensus what is going on. But for NEET SS, you need to change that. You need to read Saviston as well, add on Schwartz as well. And if you see the content, because I have made content in our app and we have given in last year also, that Schwartz is just an extension of both these books. And if you read Schwartz, you will observe that there is only 10 to 20% extra things in shorts. Rest everything is same because obviously the surgical concepts remain the same. So your goal, start with Bailey, add on short Sabiston with shorts if you have time. If you're not able to read from textbooks, read Bailey Sabiston, add on our notes that will cover the shorts as well. So first step is about the mindset. Second thing is choose your book. Start with that. Cover Bailey, go to Sapiston, add on the Schwartz content from our app, or if you're having time, you can incorporate that. But make sure that if you have time and if you are able to do it, read all three of them. If you're unable to read Bailey Sapiston, add on the Schwartz content from our app. That will be covering your all three books in general. Okay, so that is the most important thing about the books. Now coming to theory versus MCQs. Okay. So now you need to balance out the theory reading with MCQ solving. So the first point which I covered was about the theory reading, that when you read Bailey, you will be obviously reading line to line. Now, when you come to Sabiston, I have told in all my videos earlier as well that whenever you're reading Sabiston, you have to be very selective and very smart in how you read Sabiston. Because if you see our notes from Sabiston, I will tell you that if you combine or if you jot down the important points from Sabiston, if there are 10 lines given in Sabiston, when you write your notes or if you see your notes, you will see that there are 3 to 4 points important ones, because there is addition of certain trials which may not be important, certain description of the things which are not relevant. But when you jot down and do smart reading, you will come that Sabiston has given very, very, very important points. But yes, they are elaborate. But when you read selectively, smartly, you'll understand that the first reading you should filter out that, okay, from this topic, this paragraph is important, this point is important. And that is how you should do selective reading or smart reading in your first time. So that when you come to the second time reading, you have the points marked out, highlighted, and that is what you need to read. So that is about Sapiston, and Schwartz I already mentioned that how you can incorporate in your preparation. Now, coming to balancing the theory versus MCQs, I have seen many students doing different types of MCQ practice. For example, some students, what they do is they'll read theory completely since till 2 to 3 months before NEET tests, and then completely solve MCQs. Some students will wait for the theory reading, then they will start MCQ solving. Now, that both the techniques are wrong. Actually, you need to incorporate and do in synergy. How? That, for example, if you are reading about thyroid today, you have read about cancers today, or maybe you took 3 to 4 days to read thyroid cancer. Now, you must have read something before that. So, when you are reading the thyroid cancer, your MCQ solving would be of a different topic. And when you have to solve the thyroid MCQs, you have to solve them after a week of your reading. Now, why I say this is because students have the practice that, let's say I read thyroid cancer today, at night I'll make a timetable that at night I'll solve 100 MCQs from thyroid. Now, when you solve the MCQs because you have read in the morning, I can guarantee that 90% of the answers will be correct. But if you have not read it properly, the quality what I was talking about, when you come to the space recall, this is what is termed as a space recall technique, wherein you solve after 1 week. Why? Because that will make your brain work to recollect things to solve the MCQs. And that will help you to know and understand that when you are reading, how much quality is there in your reading. And this will help you in your first revision of the topic. It may be an MCQ practice, but it acts as a revision. Now, for the students who will be using MCQ Bank from our app and also the TND from our app, there is a added advantage that, let's say if you're solving the thyroid, as I had mentioned, after week you're solving the MCQ bank of thyroid. After a week or vice versa, what you can do is you can solve the test of that topic if it is live till then, or you can go according to the schedule of the TND and plan your reading of theory according to that. And what we'll do is this will act as a second revision. So over a period of 15 days, simultaneous, you are reading theory. After a week, you did your first revision. After a week, again, you did your second revision. So if you see in that 15 to 20 days or 3 weeks gap, you have almost revised twice. And when you are solving MCQ bank of thyroid, you are reading second topic. So your theory and MCQ reading is going hand by hand. And now some of the fresh MS residents will be asking that how can they incorporate this with their theory preparation or theory exam preparation. Now I'll tell you that you can follow all of this to cover the course. Okay. And just 1 month before your theory exams, you can switch over to complete revision of theory. You can stop solving the MCQs 1 month before the exam, but till then, you need to do in this way. That is how you can jog your brain to work in the MCQ oriented fashion and make your mindset in such a way that how the questions are being asked, how you are recalling, how you are answering, where you're making the mistakes. Because trust me that if you do a smart reading and a smart preparation, not just read book and solve MCQs blindly, if you do smart reading with space recall, revision, making material, using certain materials, I can guarantee you that you will score nicely and achieve your desired rank. Okay. So now I talked about the theory and MCQs, how to balance and how to do it. Now, coming to the videos and the notes. Now, there may be students who have a habit of just having a textbook reading with the MCQs. Some students may be having a habit of textbook reading with MCQs with using materials because they cannot write or have a habit of making notes. And some students will have advantage of listening to the videos, having an audio and visual memory with the notes, with the MCQs. So this is also how we have devised our plans because there are different students, but the best way to incorporate either our notes or any other notes or videos with the notes, how to incorporate them is that I don't usually tell you to go for video first and then go for textbooks. I usually feel that your first reading, no matter how good the material is, how good the lecture I have taken or any other faculty has taken from any other platform, your first reading base should be textbooks. Now, this is also which is common to all the achievers that they stuck their basics to the textbook. Your first reading always should be from the textbooks, no matter whatever you're using after that, but the first reading should always be textbook. No matter you have used certain platform material till now, whatever you have done, if you're starting NEET SS preparation from now, start with textbooks. Then if you are having habit of listening to videos, you go and listen to the topic videos that will act as a clarity of the concepts which you have understood on your own. Because if you see the videos and then go to the textbook, what happens is that you may apply the concept what you have heard, but when you read the textbook and then go to the videos, you get a conceptual clarity and it acts as a reinforcement of the concept which you have understood. And with that, or simultaneously with your theory textbook reading, you can utilize our notes or you can make your own notes and keep that material. How, what I mentioned in the starting, that your go-to material, you will be needing to prepare that from day one. And then you go on to the MCQs and the TND, as I said. Now, in the videos, I want to just add on one thing, that the surgical ethos series, what we are going to start, I'll be covering all three textbooks. You may be thinking that how can one cover all three textbooks of a topic in 2 to 3 hours? So remember that it will be covering all three, covering all the important topics, and it will be in such a way that when you listen to that topic video, you will be able to cover that topic in brief, in like covering all the important aspects, and also it will be covering the three textbooks. So if anybody is interested in this, then they can go for that. If you're not in habit of watching videos, then you can stick to the notes with the MCQs and the textbooks. That is how you need to balance. You need to understand. Don't just go that if somebody or some platform is having certain material, you have to use that. What happens is that students take certain material, start using that, and then later on just brisk away from that and they just stick to their own reading. So decide that how you're reading or how you can prepare better and then take the material. Don't take the material and then start preparing or have a planning later on. Plan first and then take and think about how you can utilize it in the best fashion. Now, about the mock exam. So, mock exam, I feel it is the most important aspects, and that is the reason why we have also incorporated GTs which are topic based. Now, why we have incorporated this topic based is that you have a habit of giving test at a regular interval, because obviously the TND will be there section based, then the topic wise GTs also will be section based. So after your reading, you give your GTs that will also act as a mock, but of a particular topic, not the whole course. But when you come to 2 to 3 months before your NEET SS, you need to start actively solving the NEET SS mocks. The decathlon series, what we conduct, and this mock exams will give you idea about the practice of sitting for 2.5 hours, analyzing your mistakes, see how your level of preparation is, and it will give you an idea about where you stand. Now, in detail about mocks, I'll take when we start the mocks, but this is very important, and I recommend that all students should go for that, and there is no substitute for mock exams. So about the mocks I have told. Now comes the important aspect of revision strategy. Now I have covered multiple times that you have to prepare your material, read in such a way, do space recall of the MCQs, but your important focus should be that whatever you are planning, you should have minimum of 2 to maximum of 4 revisions before NEET SS. That is how you should plan your schedule. And I will tell you one important aspect, that whenever you are planning a schedule, there it will happen that you may lag behind your schedule, but don't get anxious, don't get worried. Just tweak your schedule and keep on doing that. And I usually advise my students that divide your schedule by rule of 3. Now, what I mean by this is that if you are making a schedule for 1 month, divide into 10, 10, 10 days. Now, further divide this 10 days into 3, 3, 3. Further divide this 3 days into per day schedule. Further divide 1 day schedule into morning, afternoon, and night. So what will happen is that, for example, you have given your schedule of reading a subtopic of, let's say, benign thyroid disorders. You have read in the morning, give yourself positive reinforcement that yes, I've done it. When you complete the afternoon schedule, give yourself that yes, I've done it. Do it for that. Accordingly, yes, I've completed yesterday's topic. Today also I'll do it. And accordingly, so when you come to the end of 10 days or let's say 1 month, you are in the positive mindset. What we do is we will just tell that, okay, in this week, I'll read, let's say, breast. But what happens is that you don't have a plan that what I have to read in the morning, afternoon, night. This will be slightly tedious, but trust me that if you do like this, you will be in a better mindset every day, every moment in the day that, okay, I have to read this till this time. Accordingly, I'll plan the later schedule if you are lagging behind. And if you complete before time, obviously you will be able to complete faster. So that is how you should plan your revision, that you are able to do it 2 to 4 times. And to do this revision, you will need to start from day one for preparation of your material. And trust me that if you, out of the 150 questions, which was the next point, that if you want to come in the top 10, top 100, top 1000, remember that out of the 150, 90 to 100 questions are such. If you are able to do it properly, you will get in the thousands. Next, 15 to 20 questions. If you are able to do it, you will come in the top 100. And next 5 to 10 questions will be such that will be taking you to top 10. Now, if you do proper reading sincerely, this is achievable. But to achieve this, you need to do revision. As I mentioned, that you need to do this revisions. So that is about the revisions, about the how to get into the top 10, 100 thousands, but you need to prepare and have a mindset from now. Next, the two important aspects, that is the common mistakes which students do, is one, sticking to only notes. Okay. No, do textbook reading, incorporate that for sure. No matter what material you want to use, you have to use material to utilize for revision at the last moment, but textbook reading is must. Second common mistakes what students do is only solving MCQs. Only MCQ preparation is not working and it doesn't work. So don't do that. You need to incorporate theory plus MCQs. Okay, for sure. Next, mistakes what students do, what I also mentioned earlier, is they read theory, then they wait for their revision to start MCQs. No, you need to do simultaneously. Next mistakes what students do is they don't prefer giving mocks before, like for example, if you start 2 to 3 months before, you may not have prepared or you may not have completed the course. So you wait that let me complete the course, then I'll give mocks. No, you have to start 2 to 3 months before, because that will give you an idea about where your preparation is. If you need to modify, you need to do it in advance. It is not possible to change your strategy 1 month before exam. You need to start 2 to 3 months before. Okay, so that is about the mistakes. And important aspect is what I will mentor over a period till NEET SS and also regularly in the group, is that you have to stay motivated with your colleagues, friends, family. Do light exercise, meditate. Don't get worried, don't get stressed. There are 10,000s of people with you who will be in the same mindset and same journey with you. So you're not alone. So don't get worried. And one exam, one rank will not decide your future. You will have more attempts or certain other prospects, but don't think that this is the end of life. That is more very important thing. And lastly, coming to how Sushruta LGS can help you. So we are having complete more than 8,500 question bank from Bailey, Saveston, and Schwartz, which you can use because they are divided topic wise individually from 3 textbooks. Incorporate IPQs, incorporate clinical scenarios, and we'll be adding both of that. More, around 1,000 questions more will be added from Schwartz, IPQs, clinical scenarios. The surgical scholars TND. So that is basically a 30 to 50 question test from each topic of Haley, Saveston, and Schwartz, and that are all time based. And we are also one first platform which started the time bound section based mocks last year, and even will be conducting this year as well. And this will be followed by discussion for each. Now, some of you have asked that how you can utilize the discussion in your preparation. So after giving your test, what I mentioned, that when you're doing the revision or giving the test of this TND, and when you just complete the test, complete the solutions, write down the mistakes what you made or what topics or the things which you may have not read or found it tough, and then listen to the discussion, it will act as your fourth revision for that topic, and it will give you clarity about the doubts what you have. And then coming to the second edition notes what we have. So I'll just be sharing about the how they are and how best you can utilize them. So as you can see, what I have done in this notes is that I have divided each of the topic in the core theory sections and made in tabular or flowchart so that it is easier to read, given you in points, given you in certain direct points and tables so that it is easier to grasp, added the images with the legends and explanation about what we are showing in the image. What will happen is that what I have designed and what I've kept in mind is that when you are going through these notes, what will happen is that when you are reading the theory, once you have read the theory, gone through the image, gone through the explanation, then you come to the NEET SS highlights, which will be a important points from the core theory. You have a reinforcement here. Then we have the clinical scenario oriented points mentioned, which will give you an idea about, okay, from that topic, this is basically a subtopic has been divided in such a way. And then we are given either a flowchart or a tabular format. And then we have given a mnemonic for the things if you are unable to remember. And then you have the 3 to 4 one-liner MCQs for each topic and last minute revision box, which you may use at the end. So this is how each subtopic has been divided, and this is how you can utilize these notes in your preparation if you are having habit of using a material. So you will have an idea. We have given flowcharts for each topic. We have given MCQs. We have given uh, the USG, the X-rays, the images of the surgical procedures, what we have performed or what can be done for the topic. And this is how you can utilize the second edition notes in your preparation. Now, coming to next thing is about and coming to the videos and the surgical ethos series, which I've already mentioned, which you can incorporate in your preparation. So this is about how you can utilize Sushruta LGS from the MCQs, the videos, the notes, and the TND. And the surgical ethos weekend masterclass series, which I told will cover all three textbooks in detail. So this is in general about how you can prepare and crack NEET SS for sure. Now, if you guys have any queries, let me know. I'll be happy to address them and resolve them if these are beyond what I have explained already. So about the Bailey and Sabiston, I think Piyush has asked that can you read and complete now if you start with videos and MCQs and notes? Yes, obviously, as I said, that 4 to 6 months is very much enough time for you to prepare from Bailey, Sabiston, and Schwartz if you give your 200%. So don't think that you cannot. Remember that if you give yourself a challenge that I have to do it no matter what, give your 300%, you can definitely complete that. The TNDs, they'll be saved on the app. You'll be able to access them. Even this video, will be able to access them for reference later on. Uh, I, Siddharth has asked about you have used other platform for notes and now you haven't read textbook. I will not advise you to do that. Read textbook for sure. That is a must. And your first reading base should be from textbooks. For the students who are confused between going for NEET SS or INA SS or going for both, I'll advise that till 1 month before NEET SS, before INA SS, completely devote your time to NEET SS. 1 month before INA SS, you can concentrate on INA SS because both of them are different preparation or different types of exams. You need to prepare differently. So I'll not advise you to divert into two because you may not be able to give a 100% to each. So stick to one exam. Any other queries from your end, please let me know so that I can resolve them. I think I've covered almost all the queries what students had sent me. If anything is remaining, please let me know. Otherwise, we'll conclude the session here. So FNB minimal access, see the general surgery portion is definitely going to help you, but over and above that, you need to go through the SAGES manual for the minimal access because they go into more about lab surgeries, the technical aspects. So you have to read SAGES manual completely with the general surgery for the FNB minimal access. I would not advise you to read retrograde. Now, that is also some mistake. What students make is that they solve MCQs, then read the textbook. Don't do that. Read the textbook and then solve the MCQs. So that is how it will help you to understand, okay, I read this, but the MCQs is solved in such a way so that when you doing your revision, you will revise in such a way that, okay, they can frame these questions. And yeah, one more important thing what I want to add is that when you're reading textbooks from now, think like an examiner that if I have to make question from this paragraph, how will I frame an MCQ and read accordingly. For the people who are working and studying, if you're able to give divert time of 4 to 8 hours in a day, you can work and study. But if you're having financial security, if you can just sit and study, you should go for that. Or if you want to work just before 2 to 3 months before exam, leave and completely devote your last few months for NEET SS. Don't work and simultaneously study in the last few months. So the test and discussions what we are having is separate for all three books. That is, for example, basic surgical principles. Today we had the test from Bailey. Day after tomorrow will be from Sabiston. After that from Schwartz. And after a week we'll have the discussion part for Bailey, Sabiston, and Schwartz combined in 1 or 2 sessions. So if you have just studied Bailey, start again with Bailey, add on the Sebastian right now with that, incorporate our notes with that, and read Sebastian also with that. And see what happens is that I cannot give you a schedule because everyone has been reading in a different way. So NEET SS is not like school that I can give you that, okay, read 15 days this topic from Bailey, 10 days to Sebastian. It does not work like that. But yes, you can incorporate Sebastian with our notes and material, and you can read Sebastian as well. See, notes would be sufficient to cover everything. MCQ bank will be sufficient to cover everything. TND will be sufficient to cover everything. The surgical ethos will be covering all three books. But no matter you use our platform or XYZ other platform, I will recommend everyone to read textbook for sure. Textbook is non-negotiable, no matter what material you are using. If anybody tells you that you can stick to their material, I do not agree with them. Textbook is must, no matter what you use. Utilizing wrong MCQs, that's a very good question. That when you're solving an MCQ in the test mode, at the end, when you get the solutions, see that where you made the mistakes, because commonly students make mistakes in three parts. One is that they don't know the topic. Then you can just go and read that. Second thing is you get confused. Why you get confused? Because you are unable to recollect. Why you're unable to recollect? Because you're unable to revise. So you can solve that by revision. Third thing is you change at the end because you're confused. To do stop doing that, understand and see your trend, that when you are changing the answers, are you changing them to correct or you're changing them to incorrect? If you're changing them to incorrect, stop changing and stick to the first answer what you have, because the first instant is majority times correct. Mock exams is not included in any plan. Mock exams decathlon series are entirely different, and that will be a separate plan at the end. As I said that I do not recommend anyone to just stick to any material from any platform. Textbook reading is must, but saying that our notes cover all three books in detail. MCQ Bank covers every part, each and every line of all three books. The TND will cover every important aspect. It will give you clinical scenario, practice, everything. The surgical ethos series will cover all three books. So overall, you will get everything in our material, but you have to utilize that with your first reading of textbook. Second reading onwards, you can stick to our material. That would be enough. Specialty topics will increase, will decrease. It will be a mixed bag every time. You don't need to worry about whether they are asking 10 questions from neuro, 15 questions from CTVS, or 5 questions from GIT. You have to read everything and be prepared for the worst, toughest exams. No, you have to read Bailey, Sebastian for sure. Add on Schwartz if you have time. Sebastian new edition will not come before September. Don't worry about that. Read 21st edition now. Forget about that. Whenever it comes, we will incorporate all the updates in our material. So don't worry about that. Notes are must, I feel, because as I showed you that we are having 4 or 5 MCQs in every subtopic. So overall, even the notes will give you 5,000, 6,000 MCQs in general. So you can add on that to your preparation as well, and it will give you a material for revision. MCQ bank always after reading your topic and topic MCQ bank TND, that is how your pathway should be if you're using a material, because that will give you multiple revisions. And yes, keep space between your reading, MCQ solving, TND solving, so that you get spaced recall or spaced revisions. To balance videos and reading your textbooks, as I said, read the textbook and read and then watch the videos if you have any doubts or if you want to act as a revision material. So why I'm advising you to read textbook is that when you're reading a textbook, you have to apply your concepts and your understanding of the concept. And then when you read the notes or you watch our videos, you'll get the conceptual clarity, or you'll get the clarity if you had any confusion. That is how you can utilize them. Sebastian, first reading, read line to line, eliminate non-important things or mark the important things so that when you come to a second reading, you can just read that, or keep our notes along with your book and then utilize them, and you can do it smartly. There is no time limit to complete any book. See, 4 to 6 months is enough time. If you give dedicated time, 2 to 3 months are enough time to read. Almost can cover both Bailey and Savastan. Ortho part is not important. The TND are live till exams. You can give it anytime. The discussion will be live and then will be uploaded in the app. So you can attend them and watch them at any time. Any other queries? I think I've covered all the queries what you have asked in the chat as well. About the ENT and the neurosurgery and the surgical group exam, I'll get back to you. I'll have to check for you. We are planning to cover in next 3 to 4 months. The TND and everything will try to cover and complete in 3 to 4 months so that you have adequate time after that as well. As I said, the exam can be in December, can extend to February as well. Don't worry about how many questions you have to attempt right now. I'll be taking a session at the end before few months of exam, and I'll be guiding you on that about how you can attempt the exam properly. Think about how you can revise and read properly. Now that is your goal right now, not about how much to attempt and how many questions. Don't worry about that. Yes, I'll be taking multiple sessions in between like this, so don't worry about that. I'll be there to guide all of you throughout your journey, so don't worry about that. INISS surgical part, can you be elaborate about what you are trying to ask? I did not get your question. You can go either by topic wise or subtopic wise from both books or 3 books. You can, as you said, you can read benign liver lesions from Bailey, Savage and Schwartz. That would be better rather than reading liver hole from Bailey, then Schwartz and then Schwartz. That is not smarter. You can go with subtopic like benign liver lesions. You read from Bailey, Savage and Schwartz, or incorporate into your own notes or user notes where you have incorporated all 3 of them. GTs, topic wise GTs, what we have in our app, you can start doing now. But the main GTs, you can start 2 to 3 months before NEET SS. That is the right time to do them because you can analyze and modify at that time, not now. It is very good idea to cover your theory reading with MCQ practice during your MSc exam because you are in that preparation journey from now. So don't wait for the theory exam to end to start for NEET SS. Start from now. So INISS simultaneously for the general surgery portion, it is same. You don't need to do anything else. And the added advantage what we have given you all is that we have the biostats question in our app. So you can utilize that for the INISS because we have not seen the biostats in NEET SS as much. So that way you can utilize the biostats extra for the general surgery portion and the remaining portion remains the same for both NEET SS and INISS general surgery or the surgical general surgery questions. Daily MCQ solving varies, but minimum 50, maximum of 100 to 150 if you have time. Minimum 50 to 75 for sure. Daily MCQs. So, so minimal access surgery, basically remember that it is not a extra thing. It is about the insufflation or the lap instruments or the angles or the techniques or the positions or the port positions. So that are the few questions which are extra in minimal access. Rest of the thing are same as general surgery. There is no fixed pages reading. This is you don't have a fix that I will not be able to tell you that okay you need to read 100 pages per day. That is not how it works. You need to read properly with 200% quality so that when you do after week you should have that revision or recall should be there. As I said, 2 to 4 times revision is must before NEET SS to get a good rank. There is no pattern for NEET SS, so don't think about that. Think about how you can completely cover the textbooks and the topics, every topic properly. That is your goal, not thinking about specific topic wise. NEET SS decathlon series mock exams will be conducted 2 to 3 months before the exam so that you can solve at that time. Right now, focus on textbook with MCQ bank with the TNDs and the lectures. There is no high yield topic in NEET SS, so I won't be giving any high yield topics. You have to read everything. Specialty GIT endocrine is must from Sabiston if you do not have time, but I'll not advise you to do selective reading. I don't like giving any high yield topics because there has never been any high yield topic from which question has been asked for sure. It has always been a general paper from they ask from everywhere. Any other queries? Please let me know, or we can end the session here and you can reach out in the group also. You can send your queries or you can send to me also, and I'll be happy to address them. Yeah. If you cannot read Schwartz, our MCQ bank, mock exams, videos, notes will be enough for Schwartz. You don't need to read Schwartz separately. You can just use our material for that. There is no such thing as recent updates, basically, because if there are important trials, we'll be covering them in our material. Other than that, there is nothing specific which you need to concentrate on. I told for the SABI, I told that if you cannot cover them completely, you have to cover specialty, GIT, endocrine for sure. Okay, then we'll end the session here. You can reach out to me on this number, and if you have any queries, or you can join the WhatsApp group and you can send your queries there. I'll be happy to address them if I've missed out any. Okay, thank you all.